So if my client wants to follow a low carbohydrate diet, what should I do? First of all, we need to know what is low carb, a method of teaching people how to eat consistent amount of carbohydrate at meals and snacks at similar times each day with the end goal of achieving glycemic control and other diabetic metabolic nutrition goals. So we have to explain to the patient how good it is, why should they, and what should they do. So carbohydrate counting is a meal planning technique to manage blood glucose, to plan insulin dose with regard to the meals. Enables flexible eating schedule and more dietary freedom. For people on multiple daily insulin injections or on insulin pumps, it's very useful. Carb counting has a lot of evidence of reduction of HbA1c 0 to 1.5%, significant reduction in hypoglycemia, no rise in incidence of hypoglycemia, and improved quality of life. So patient selection. First of all, we need to know that these patients should be able and should be prepared to use a blood glucometer to check serum glucose if on insulin. Communicate with the healthcare team during the low carbohydrate diet intervention. These guidelines may not extend to patients with acute unstable medical condition, pregnant women, or those breastfeeding. So counseling, first we need to evaluate the patient's current symptoms, past medical history, when was the diabetes diagnosed, time of progression to insulin requirement, history of hypoglycemic episodes and diabetic complications, other comorbidities, current coma medications, and baseline laboratory workup too we need to look at. Physical measurement of weight, height, BMI we should know, weight circumference and blood pressure. So choose carbohydrate counting if the client he has a desire, increased flexibility of food choices and timing of meal, frustrated or confused by perceived dietary restrictions on sweets and calories. Sorry, excessively focused on sugars per se without understanding the portion of carbohydrate foods, has a nutrition history that shows frequent use of preference for high carb food, simple carb foods. The one who avoids plant-based foods such as other plant-based foods, reports on unexplained problems with hypoglycemia, hyperglycemia, or both, uses insulin but makes no adjustment for hyper or hypo, has a poor diabetes control, HbA1c always above 8%. Patient education, we need to educate the patient what's carbohydrate counting and its benefits. We need to teach which are rich in simple carbohydrates. Average portion size we need to teach. Carbohydrate gram counting, exact number of carbs in each meal or one portion. Exchange of each food containing 15 grams of carbohydrate, how he can exchange, number of serving to be selected in each meal, importance of adhering to the above. What are some indicators of carb counting will be helpful? Assess existing knowledge. What are the foods food group contain? We need to ask the patient to understand what's his knowledge. What are the foods food group do not contain? What is the impact of various fruits? Choose carb counting if the patient has heard about carbohydrate counting and asked to learn about it. Calculate a carb requirement. For example, 1500 calorie. You need to take calories from carb 50 to 60%, carb gram per day, calorie divided by 4. One carb choice is 15 gram. Number of carb choices per day. We need to find out. Next is basic carb counting. Distribute carb gram choices between meal and snacks. Prepare individualized sample diet. We cannot make some set menu and tell the patient follow this. Timing of meal and insulin plan should match this. Meal and snack timing and amount of carb for given meal to be fixed from day to day. Carb exchange list for variety and consistency. So gram of carbohydrate per food category, starch and fruit, one serving, about 15 gram carb, milk, one serving, about 12 gram carb, vegetable, one serving, about 5 gram carb. So we need to teach the tools for carb counting, especially when patient is on insulin. See, we need to tell what is a teaspoon, what is a tablespoon, weighing scale, measurement jar, and everything. Portion sizes we can teach like this: tight fist as half a cup, handful as 1 cup, palm, hand guide portion, thumb, full thumb for 2 tablespoons or 1 ounce, thumb tip for 1 teaspoon. See, if you look at vegetable, one healthy serving, cereal, one hand, fish portion, cups and spoon, and other measures. So, sources of carbohydrate we need to explain: cereals, pulses, legumes, fruits, starchy vegetable, milk, yogurt, and sweets, without carb of meats, eggs, fats, and oils. So roughly RDF for carbohydrate is 130 gram per day in a minimum requirement. So for different calorie diets, how many grams carbohydrate is allowed? The list is there. How we can distribute the carb exchanges from different foods is given here. This is how we sit and plan. So again, another exchange list of diabetic exchange list of carb, protein, fat according to the calories is there. So 5 steps of starting on low carb diet. First, setting the low carb health goal. If on diabetic medication, the doctor must be consulted before beginning. Low blood sugar can be very dangerous. Doctor might recommend to decrease the diabetes medicine or to avoid low blood sugar. May need to monitor blood sugar very often. Have medicines changed if sugar goes too low. If he's on high cholesterol or high blood pressure medication, because of this diet plan, these two can come down, and he should avoid dropping the BP too low. Setting nutrition target, carb target. Setting a carb target is an essential step for starting a low carb diet. While there is no official definition of low carb, 30% of carb, calorie from carb is a default for a moderately low carb plan. Different variations of low carb diets are available. Number of carb will vary depending on insulin tolerance and activity level. There is a keto diet which is quite popular today, under 20 gram net carb per day, sometimes under 25 to 30 gram. Low carb diet under 50 gram net carbs per day. Moderate low carb under 100 grams. Some people opt to count carbs diligently. Some choose simply focus on to eat low carb or keto foods they call. If you see keto diet, the carb is very, very low, fat is high. Low carb diet, maybe up to 30% carb, and fat is up to 70%, and protein is up to 30%. So stocking the kitchen is very important. One may feel a bit overwhelmed before starting low carb diet. You need to take some time to plan for the new lifestyle. We need to remove the tempting high carb items from the kitchen to stay on track. And punch up nutrition, we need to choose fats and oils diligently, healthy fats. High fiber diet fills more and gives healthy carb. Consider a multivitamin or mineral supplement too. Find support. Solid support system can make a big difference in the success. Let the friend and family know that they can support you. Summary: starting a low carb diet the right way will increase success and maximize nutrition. There are enough publications: a clinician's guide to inpatient low carb diet for remission of type 2 diabetes towards standard of care protocol. They've told all these 7 steps: patient selection, pre-diet evaluation counseling, patient education, initiating dietary intervention, managing medication changes, addressing any side effect and follow-up. This protocol serves as an initial framework for developing clinical practice guideline and the standard of care for using low carb, using carb reduction as an intervention for type 2 diabetes and related standard of care protocol. So there are two: basic and advanced carb counting. Both require a thorough understanding of target blood sugar level and difference between basal and bolus insulin. Patients should be willing and should be able to keep adequate records, including blood glucose monitoring and food intake records. He should be encouraged to work with a registered dietitian or a diabetic educator experienced with teaching these skills, which is very, very important. So coalition pushes for low carb diet to be added in 2020 dietary guidelines. A coalition of doctors, academics, and American consumers called the Low Carb Action Network is urging US nutrition leaders to include a low carb diet as a part of 2020 dietary guidelines for Americans. Thank you very much for your patient listening.